So we're going to move on to item 6.2, or 9:06 a.m. item, consideration of update on COVID-19, and I see that we have Dr. Bloom with us in the Zoom room. Dr. Bloom, the floor is yours. Good morning.
Thank you. Good morning. Thank you, Chair Sabatier, and good morning, Board. I wanted to very briefly discuss the COVID response within Lake County, and along the same lines as previous, I wanted to discuss our cases, our tiers, and our vaccination situation, and then shift it over to Sarah, our epidemiologist, to discuss the numbers in detail. And the short of it is that things remain the same. From last week and the week before, case rates are low. Our case rate is about 3.3 per 100,000, and our testing positivity is 2.5%. This is, again, delayed data, so I don't have the data for the past few days, as is usual for our presentations. And I only make a mention of that because there have been some upticks in cases around Northern California in a few of the various counties, and we are seeing some indications of possible mild upticks within Lake County. However, that remains to be seen with our numbers. So what I would like to report is that things are remaining the same as far as we can tell at this time. Unfortunately, the things that are remaining the same are also our vaccination coverage rates. We have just less than 1,000 vaccinations administered over the past 2 weeks. And so we will be discussing that later in the presentation regarding our approach to try to increase those rates. At this point, I would like to send it over to Sarah so that we can discuss our numbers in detail. Sarah?
Thank you, Dr. Bloom. Good morning, everyone. A quick update. On the status of COVID in Lake County. First, we'll look statewide. Testing is declining statewide, but fortunately, the test positivity rate remains low at 0.8%. The daily case rate statewide remains low at 2 cases per 100,000. Later today, the state will announce the tier metrics for the next week. Lake County will remain in the orange tier, which indicates moderate transmission based on metrics from May 23rd to the 29th. Dr. Bloom already shared a daily case rate of 3.3 per 100,000. That's 15 cases identified in that week, and a testing positivity of 2.5%. The map here shows you that 35 of California's 58 counties are also in the orange or moderate tier, and 19 counties are in the yellow tier. Next week at this time, the state will be running the blueprint officially for the last time. So we will have metrics like this to share with you, but they won't have any impact because the state is sunsetting the blueprint on June 15th. So just to repeat that, we'll have the metrics, but the blueprint and the rules governing what can be open and what can't, and where there's modifications will sunset June 15th, as I think you're all well aware of. What I just want to point out here, this is the epi curve. So this shows us the number of new cases identified by week in Lake County among Lake County residents. And so Lake County has been really stable since mid-April, ranging from 12 to 24 cases identified over the last 2 months or so. And for the week of May 30th, the week that just finished, we've identified 8 cases as of Sunday when I ran these data. So again, looking like this past week will remain stable. Testing is declining slightly in Lake County. It's also declining statewide and in many other counties. But compared to a lot of other rural counties, Lake County is doing a good job of testing, keeping the testing rate up. Like Dr. Bloom said, we've been stable in cases, and progress towards vaccine coverage has really slowed. So over the last 2 weeks, about 950 people were newly vaccinated. Statewide, the week of Memorial Day, we really did see a slowing of the number of new people getting vaccinated. But really, we're looking at about maybe a 1% increase each week. So I think that's important to think about with the goal of herd immunity around 70% or so. So as of Monday, nearly 30,000 people in Lake County were at least partially vaccinated, and that nearly 25,000 are fully vaccinated. So that's 53% of Lake County residents 12 years in age and older are partially or fully vaccinated, compared to 66% of Californians. And I'm going to move through the next couple slides quickly because really nothing has changed in the last couple of weeks. The zip codes on the left, 95422, 95423, and these four other zip codes, about 41% people 12 years of age and older are partially or fully vaccinated, and about 52% of people living in these other 6 zip codes, such as 95426, 95451, and the other 4 zip codes listed. About 45% of Latino residents are partially or fully vaccinated. About 46% of white non-Hispanic residents are partially or fully vaccinated. These data here still do not include data or vaccines administered by Indian Health Service, so it's an underestimate. According to these data, about 36% of American Indian or Alaskan natives are partially or fully vaccinated, but we know in reality it's higher due to the work of your tribal health partners. By age, there's been, as I'm sure you're all familiar and we've spoken about previously, 12 to 17-year-olds are now eligible, and 8% of Lake County people 12 to 17 are partially or fully vaccinated. 37% people 18 to 49, that's about 22,000 people in total, so 37% of 22,000 people. Slight increases among 50 to 64-year-olds, now 2 out of 3 50 to 64-year-olds partially or fully vaccinated, and 61% of people over the age of 65. And just one last slide to show you how that's really stalled among people 65 and older. This is looking at least partially vaccinated over time, and you can see this line flattening here in pink. You can see the increase starting in young people as they become eligible, and sort of steady but slow progress among people 18 to 49. So I'll close with that and just say that we'll continue to watch the data. Cases look stable. Vaccine progress is slowing, and the disparity between Lake County and the state coverage level is growing because while it's slowed statewide, the state is vaccinating at a slightly higher pace than Lake County. Thank you.
Thank you.
Thank you, Sarah. So again, to reiterate, the cases are looking about the same as they have been, and the tiers are going away on the 15th. And so I did want to stress that although the restrictions for businesses are going away, and that we are all happy that they're going away, the virus is not going away. The virus is still here, which is why vaccination is important. The virus comes in waves, we all know that. The virus differs in times of the year. It differs in different seasons, which is why vaccination is still important and why we are concerned that the vaccination rate and coverage is slowing, particularly in the 65 plus age range, and in the 18 to 49 age range. So vaccination is still important because we have not reached a level where we would feel that we could avoid a significant surge based on vaccine coverage of the county. That being said, when the tiers go away on June 15th, please remember that you have to take caution and that reasonable protection is important. And that if you feel that wearing a mask is important, go ahead and wear a mask. And that if you are in locations with lots of people, remember that you should be social distancing. If you cannot, if you are in an area where there are many people around you, because you will be at a higher risk of contracting COVID since you don't know the vaccination status of large groups. We have had some large events recently, which unfortunately, at some of them, we have noted that masking and distancing did not take place. And we have not seen the results from this yet regarding cases. However, we are starting to see a few cases that we identified were in people at those larger events where masking and distancing did not take place. And so this is particularly what we at the Department of Health are concerned about in the coming months, particularly in Lake County with July 4th. So we want to celebrate July 4th, and we are very happy that our case rates are low, but please make sure to do so in a responsible fashion. Don't celebrate inside with a ton of people unmasked. Be careful. It's for your own good, it's for your own safety, and it's for the safety of your family. So I'm not going to harp on this anymore, and we're very happy that the restrictions are going away, but again, the virus is still with us, unfortunately. And so use your common sense for you and for those around you. As far as vaccination, we have all of the different types of vaccine within the county. We have Moderna and Pfizer and Johnson & Johnson, and you can still go to My Turn and schedule. You can walk into a number of the different vaccine sites, whether that be in Lower Lake, whether that be in Lakeport, whether that be at Walmart or the pharmacies or Safeway. And then we are going to have a few more sites opening up as well, which will be accepting appointments through My Turn or walk-ins, which I'll get to in a moment. So plenty of places to get vaccinated. And so I highly suggest that if you haven't been vaccinated or if you're partially vaccinated, that you should do that. In addition, I did want to mention the incentives with the state of California. If you become vaccinated before June 15th, you will be entered into a large lottery for a significant sum of money as an incentive and as a thank you for getting vaccinated. And then also, individuals who are not yet vaccinated are actually eligible for a $50 incentive from the state when you become fully vaccinated. So if you have not been vaccinated, that is a little bonus that will say, okay, well, if you're thinking about getting vaccinated, which you should be, that this is a nice little thank you to say thank you for protecting yourself and protecting those in Lake County to get vaccinated. So you will automatically be eligible for that, and then when you receive your vaccinations, you will receive the gift card of $50 to be used in many different outlets across the county. And if you want to find further details about that, you can go to the state website, CDPH website, as well as if you type into Google, California, Vax for the Win, you should be able to find it as well. As far as strategies at this point to increase our vaccine coverage and our vaccination coverage across the county, I did want to mention that the Department of Public Health is working on a number of different fronts to try to increase the vaccination coverage, again, incrementally, within the county. So the Department of Public Health has been working closely with our schools and school boards, and we have received funding from the state, as well as has the school board, to assist with vaccine and vaccination coverage. And we will be starting with clinics at the schools for children and for families of children, hopefully in the next week, we will begin this on a rotating basis across schools across the county, but the plan is to start this coming week. As well as this, the Department of Public Health is working with the Department of Behavioral Health of Lake County to provide vaccination services for those who want them, who are clients of behavioral health. And these are anticipated to be offered at behavioral health different locations and clinics. And so you should talk to your behavioral health provider if you are interested in a vaccination. As well as that, we are working with other partners across the county, smaller groups, to provide vaccinations, as well as primary care physicians' offices. We have been in discussion with our local Center for Medicare and Medicaid providers to support our primary care physician offices to deliver vaccinations, as well as are currently in discussions with our health systems to further support the primary care physicians' offices and clinics throughout the county to provide vaccinations for all of their clients. As well as this, the Department of Public Health will also be opening clinics at the Department of Public Health to provide vaccination services for members of the county. As I mentioned before, these are new clinics that will be opening. I can't quite yet tell you the hours. However, there will be a robust amount of hours and dates available for any of the different types of vaccines that we discussed, Johnson & Johnson, Moderna, or Pfizer. And those clinics hopefully will be starting this coming week. So look for more information for that. You can find the information on our website, but also you can go on to My Turn this coming week and book an appointment, because appointments will be bookable on My Turn for the Department of Public Health clinic, which will be at the Department of Public Health. And you can also walk in if you don't want to make an appointment, as walk-ins will be available. Lastly, I wanted to mention something that I discussed at previous meetings, which are mobile teams. So the state has provided access to mobile vaccination teams, and we have applied to have mobile vaccination teams come to the county pending approval. And so the plan is for these mobile vaccination teams to come to the county and specifically to help with vaccinations in that HPI 1 group that Sarah just discussed in those various zip codes. And we can discuss further in the future the progress of this, but I did want to mention that this is going on, as I know in previous Board of Supervisors meetings, there have been some questions about mobile services or trucks going around to vaccinate folks who would like vaccination, and so this is in process currently. Lastly, I did want to mention, because Supervisor Pyska asked 2 weeks ago regarding senior centers, and so I wanted to mention that there have been outreach to senior centers and meetings with the senior centers within the county. And after long discussions, the senior centers at this time have expressed that they are not comfortable opening currently for full in-building services and in-building congregate meals, and therefore we will be having ongoing discussions throughout the next number of months on a monthly basis to discuss opening times and to discuss any concerns in an effort to become fully open and to start having our normal services at our county's senior centers, as they are quite important to our senior population. That is the update for Lake County. So in summary, the cases are flat at this point, although we are a little bit trepidatious that there may be some increased case rates based on the county rates around Lake County, as well as the fact that the tiers are going away on June 15th. And therefore, again, just to stress it, please use your common sense when you are out celebrating July 4th. Have fun, celebrate July 4th, but do it in a responsible fashion for your protection and your family's protection, please. Because we do not want to see a surge of cases in the county that can lead to significant hospitalizations and significant illness for the residents of Lake County. We have been doing such a good job, so keep it up and be careful and be reasonable. Please, if you have not gotten vaccinated, get vaccinated. Consider getting vaccinated. Talk to your primary health care provider. Look on the web regarding vaccinations from trusted sources, the CDC, California Department of Public Health, as there are many places to get vaccinated, as I just mentioned, as well as the Department of Public Health, again, will be opening our clinics as well this coming week, which will be available on My Turn or for walk-ins. And with that, I thank all of the partners that the public health has been working with to try to increase our vaccination rates for the county. And I wish everybody in Lake County good health, and please be careful out there and be safe and be well. Thank you.
Thank you, Dr. Bloom, and thank you, Sarah. Any questions or comments? Supervisor Pyska.
I think we can all appreciate the welcome news that we're going to have changes coming to the county next week and throughout the state, but it's also important to be considerate of others' choices. We don't know what people are, other people in their families, if they're not vaccinated, if they have illnesses. So I think this is going to be a time when we just really need to be considerate in general of each other and our choices. So I appreciate you, Dr. Bloom, following up about the senior centers, and it's certainly understandable that they're remaining cautious at this time. I'm wondering how the conversation's going as we prepare for fire season, and if those senior centers are going to be able to be a resource for seniors if there's an evacuation or if there's a fire. Have those discussions begun?
So the answer to that is twofold. Number one, the discussions have mainly been surrounding just reopening in general in the setting of COVID, and they have not necessarily focused on fire season and the centers being a resource during fire season. However, there have been some email discussions regarding that. So the discussions have begun, but they have not taken place in any robust fashion to this point. But you do make a very good point, and senior centers should, as they are very important centers for the community, be a important resource during fire season. Secondly, the discussions, again, about reopening will be happening throughout the summer months. Right now, on a monthly basis, they may be occurring more frequently than that, and I'm sure that those discussions will be upcoming further during fire season.
Thank you.
Thank you. Any other questions or comments from the board? All right, let's go ahead and open it up to the public. I see we have one already in the Zoom room, phone 4627. If we can unmute them, and then please provide us with your first and last name.
Well, I got a voice saying I'm unmuted. Can you hear me there? Because I don't hear anything on the phone.
We can hear
here.
you now. If you can please provide your first and last name, you have 3 minutes.
Oh, okay. Thank you. And thank you, Dr. Bloom. My name is Tom Slate, and I have a question for Dr. Bloom about adverse reactions. And as far as I know, the manufacturers of these vaccines are not held accountable and apparently can't be held accountable. So my concern is if, Dr. Bloom, if people were to follow your lead, as I understand it, and get vaccinated and then have a adverse reaction, are you agreeable to taking full responsibility?
I'm sorry, so am I as the public health officer of the county taking full responsibility for an adverse reaction to a vaccination. I believe that was the question, so I'm sorry if I misunderstood that, but that is what the question seemed like. I am the public health officer for the county, so I am not in a position to take any sort of responsibility for an adverse reaction from a medicine that is administered. So that being said, vaccines are administered throughout life, throughout the world, and as are many other medicines, which all have potential adverse reactions, which are well publicized, as are potential allergic reactions or other adverse reactions to these vaccines, as with any vaccine, as with any medication, such as penicillin, such as Advil, such as Tylenol. And so as I would not personally be taking responsibility for any adverse or allergic reaction to Tylenol, it is the same with any other medication that would be administered. I hope that answers your question.
Thank you very much for the response. Any other public comment? Let's start in the Zoom room first before we move on to the chamber. And we have Will Tuttle, if we can please unmute. And you have 3 minutes.
Yes, thank you very much. And I'd like to respond to some of what was said just now about the rollout of the COVID vaccines. And one of the things that I learned recently is that already over $3 billion has been, of our taxpayer money, is being used to promote everyone getting vaccinated by the U.S. government. And so that money is an enormous sum of money. That's $3,000 million to try to get people to take a vaccine. And in many ways, I think it's important, as we see in the graphs that we saw, that people are resisting this. And I think I'm speaking for thousands of people here in Lake County who do not want to be vaccinated, and I think who are outraged that so much attention and money is being diverted into trying to get people to take a vaccine that has never been tested on human beings. This is really a big test that's coming out. It really wasn't even properly tested on animals. It's been tested on animals for the last 20 or 30 years, these mRNA vaccines, and they're all in the animals. So now it's just directly to human beings. And we have people who are out of research. Robert F. Kennedy Jr., for example, has been studying this for many publicly and started the Children's Health Defense. His most recent statement is, quote, "The new COVID vaccine should avoid at all costs." That's what he's saying based on his research. We have Dr. Peter McCulloch, and I sent you all on the board a video link to his statements. He's extremely highly respected MD, a professor of one of the most respected universities of medicine, and he has come out and saying this from the very beginning, this has been all about the vaccine. There's never been a more dangerous vaccine ever. I mean, it's in just the first few months of the release of this vaccine, more people have been killed or injured than in 30 years of vaccines already. I mean, this is off the charts. And so with all due respect, when we hear statements that the public is being informed, I think we are not being informed, we're being misinformed. And this is a direct violation of the Nuremberg principles, all 10 of them, which require informed consent. We're not getting informed consent. And I think the board is obligated to give the other side on this, to do the research, and to protect the people in our county, because we're not hearing the truth. We heard 2 weeks ago that the spike protein just sort of disappears, that the mRNA creates a spike protein. Just now, recently, Dr. Byram Bridle from Canada, one of the top vaccinologists and virologists, came out and said, basically, we made a mistake. He said that the spike proteins are very harmful. They collect in the spleen. They move from the spleen into other organs like the bone marrow and the heart and the lungs and the brain, and they cause blood clotting. We find teenagers dying of blood clots right after being vaccinated. We find
Your 3 minutes are up. If you can get to your final point, please.
Okay, thank you very much. So I want to just encourage the board, please, to continue to present reasonable scientific validation for what I've been saying. These are facts.
Thank you. Phone 6478, I believe that was the same one, so let's put you on hold for a second. Let's open it up to the boardroom to see if there's any new public members that wish to make a comment. Anyone from the boardroom wish to make a comment on this item? Seeing none, let's go ahead and go back. Phone 6478, I wish I had a name for you. I forgot your name. If you are the same person that already made a comment, if you can provide a succinct comment since you've already had your 3 minutes, that would be appreciated. We have a large group here waiting for us to get to their item.
Hello? Yes.
Oh.
Can you hear me?
Yep, no, it's a different voice. Sorry, but you have 3 minutes.
All right. My name is Madeline, and I like to urge you to use some of that big sum of money to educate people to have alternatives to the vaccine. So if they don't wish to take the vaccine, they can take all these other things like vitamin D, C, zinc, and boost the immune system. And also educate about a better lifestyle, getting into the sunshine and exercise and all that. It's very well needed, especially in the American culture. So please do that. Thank you so much.
Thank you very much. And there is no more public comment in the Zoom room. And again, checking the boardroom, I see no one moving to come and make a comment. And coming back to the Board of Supervisors, any final questions or concerns or comments?
I just want to say I appreciate that last comment by Madeline, offering another solution as opposed to not taking or taking the vaccination. You know, that's pretty, I think it's pretty cool.
Well, living a healthy style is always a positive note, but at the same time, I will suggest that we tried an alternative before the vaccine came out, and it wasn't working out too well for the entire world, let alone the United States. And I think that it's a difficult task to be cautious when the virus doesn't really care. And it crosses all lines and barriers that we unfortunately create socially. And I do see a hand has come back up. I don't want to ignore anybody. 6205, if it's a repeat, please be succinct.
Good morning. Can you hear me?
Yes. You have 3 minutes.
This is Bart Levinson. I wanted to add to the comments by Supervisor Pyska to Dr. Bloom concerning the senior centers and addressing preparedness for the fire season for the seniors and the issue in general of what use the senior centers are going to be able to be going forward, given that they've been closed during the pandemic. The Lakeport Senior Center announced recently on KPFC radio that they would be closed for an additional year. It seems that each center is operated differently and plans to have different criteria for who will be allowed in, including not just the seniors, but the volunteers. This is a matter of, I think, much more immediate concern than Dr. Bloom may realize to prepare for the fire season. In the past, senior centers have been used as local assistance centers, evacuation centers, and are generally places that seniors are used to knowing that they can go to. This whole past year, they've been told they cannot. So I would ask Dr. Bloom and the supervisors to more urgently look into what is happening at the senior centers. How are they being utilized? Are they open to the senior public? And I think you'll find that in many ways they are not.
Thank you very much for your comment. All right, we're going to go ahead and close this item. Dr. Bloom, Sarah, thank you very much for your time today and your presentation.
Supervisor Sabatier?
Oh,
I
I'm
just
so
want to
sorry.
highlight, I'm not discouraging the vaccine. What I was saying is if there's people that are choosing not to take it, at least do something to enhance your system. You know what I mean? That's all. I appreciate another option is what I was trying to insinuate.
Thank you for the clarification. Supervisor Simon?
Yeah, I just want to make a comment on the senior center. You know, each one of us have a senior center in our district, and what I do want to say is, you know, it is a challenging time, obviously, for everyone as we move into the 15th, as we move forward, but I know that the senior centers in my district and most likely all around the lake have done a great job with the drive-through food, communicating with the seniors, you know, for vaccinations and other things. So I know it's a challenge as we move forward, but they each will make their decisions as they feel safely, and I think we should respect those as much as anything else. I know that as a county and as a board, we have our folks that are working on and being prepared for fire season, where the evacuation shelters are, where the immediate places that for folks need to go. So I just want to make sure that our senior centers in this comment are appreciated, and I know it's challenging for everybody. So they've done some great work, and they continue to do that to support our seniors. So just wanted to say that also.
Yep, thank you for the comments. And that looks like that concludes our item today on COVID-19. Again, Dr. Bloom and Sarah, thank you very much for your time today.